Hello, friends. Welcome to all of you. Today is 21st June 2025, and I welcome to the PLAB webinar, a gateway to practice in UK. I'll be telling you everything about PLAB, and of course, many other things I'll be covering with you. Well, but before I proceed for PLAB, I know you'll have a lot of queries to ask me. Please post your queries in chat box. And once I finish my session, I'll be definitely will answer all your queries. Even after that also, I'll give you my number and contact details so that we are very much accessible to all of you even later on also. So first question is, what is PLAB? Well, this is an exam conducted by the General Medical Council, GMC of UK. GMC, just like NMC of India, previously it was Medical Council of India, but now we call it as NMC. So similarly, every country has their own regulatory body. So in UK, it is GMC. So they conduct. Now, any student who passes PLAB, any international, okay, whichever country you are in the whole world, if you pass PLAB, you can very well work as a medical doctor in the UK. You are allowed to do the practice in UK. So in summary, is a work permit for UK to work as a doctor. Now, what is the eligibility criteria? Who can write this exam? Well, you should have done MBBS from any recognized institute in the world. That is already there with you. But either you should have completed internship, or even if you are doing internship, you can apply for PLAB. Okay, but you can write exam only once you have finished internship, because it takes little some time to get date for PLAB also. So it's better to start whenever you are entering the internship, you apply for the PLAB. Well, before that, you write PLAB exam, your English exam, IELTS or OET should be clear. But it is a very easy exam, especially for India or people of the Indian origin. Because our English is good right now, right from very beginning, we are being taught in English. This is the problem for those students of those countries where English is not a very commonly spoken, like China, Thailand, etc. But otherwise, for Indians, it's a very easy exam to pass. Now, what are the PLAB exam structure? PLAB is conducted in two parts, PLAB Part 1 and PLAB Part 2. Let's learn more about these two parts in more detail. One, this is for the format of the exam. There are 180 questions to be done in 3 hours. They're all one-liner questions, MCQ questions. And again, the way India also in the NEET PG or FMG exam also, especially because we have a one-liner question, same type of format is there. Frequency, it is conducted 4 times a year. It's a beautiful line. Unlike the NEET PG, which is done once in a year only, if somebody doesn't get a required seat in 1 year, he has to wait for 1 more year to write exam. But it's not like that. 4 times, March, June, September, and November are the months where it is done. Location, it is done pan-globe. All over the world it is done, of course, but as far as India is concerned, it's done in cities like Delhi, Bangalore, Chennai, and cities and other international cities. Every person in the native country, they can see the site in the Google, it is given. Now, what are the syllabus? Mainly clinical scenario-based UK foundation. Okay, it is UG level exam. In summary, if you talk about in pertaining to Indian scenario, it's a very easy exam. Usually medicine, surgery, psychiatry, OBG, pediatric, ethic, emergency. So very, very easy exam. The level is very low. Why and what the meaning I'll be discussing in the coming slide. Primarily, they talk about the clinical subjects. And whatever pre and paraclinical, they're all based related to something, related to clinical side only. Now, PLAB 2. This is a test of communications skill. They don't expect you to know much hi-fi. But what they expect in PLAB 2, you should know how to talk to patient. And that is okay, but you have to pass PLAB 1. Now, PLAB 2 exam, we don't do. It's a practical training program. In fact, it is exam happen in UK only. And we have a colleague, Dr. Swami is there in UK, he's an expert. You join his classes and you are 101% is the success rate. For that, I'll guide you. Now, let's talk about PLAB 1 and 2 location. So as I told you, PLAB 1, multiple center in India and worldwide, the point I already mentioned. But again, re-emphasizing, PLAB 2 occurs only in UK, that also in Manchester City. That means once you pass PLAB 1, you have to go to UK to stay there, get training and write exam also. Now, a very commonly asked question, PLAB versus NEET exam. What is the comparison? This is one of the most important things that you should understand. Okay, well, when we say NEET PG, that means in student in India, they have done MBBS and passed NEET, okay, and they are writing for NEET PG. Even those who are outside India, okay, they have to first clear FMG exam, then they do internship, and then they go for NEET PG. So let's compare the two. And then again, I'll talk separately for FMG also. Difficult level is very easy exam. It is very tough. Why? Maybe that means more and more 2.5 lakh people write. And imagine, this is very easy exam. It is at least much tougher. Difficulty, again, I'll discuss in the coming slide. Career path, you directly enter into National Health Service of UK. Once you're done, you are into system. Then you can later go for MRCP, MRCS, whichever branch you want, you can take it. But in contrast, NEET PG, you have to enter in India only to get any MD seat. But that's not an easy thing that everybody knows. Salary much higher than UK, much lower in India. Your salary in UK is at least 10 times what we get in India. Scope for specialization, anything, you can do specialty, super specialty, any branch, without any competition. That is the biggest advantage. And here, tough competition is there that you know very well. So note competition about this. Again, I'm going to discuss in the coming slide. So I talked to you difficulty level, very easy. Now let me explain to you, what do you mean by difficulty level? Look into this. This high jump, everybody has seen in the sports event like Olympics. Now, suppose I say the difficulty level of NEET PG and FMG also is 100 difficulty level. PLAB is 40. Oh, so easy. If you can jump this, for you jumping this is very easy. I think this one picture is self-explanatory, is very easy. Okay, very easy exam, much easier. Second thing, this is a game of musical chair. There are so many people who are coming in, and finally you are only one chair is left. Indian exams are like that only. NEET PG in particular. One of the biggest problem in India is reservation. A huge amount of seats are reserved. We don't go into that point. Okay, now one seat is there. 100 competent, equally intelligent, equally competent people, they compete for one seat. So one student get a seat, 99 will not get seat. 99 students will not get it. Are they not good? They are very good. The problem is single seat. And in India, 2.5 lakh people write the exam. And if you want a good branch like MD, medicine, radio, pediatric, the common branches, in any good college, you have to be among the first 10,000. 10,000 people we have to be, out of 2.5 lakhs. Right? Moreover, Indian PG exam, the total seats are somewhere around 80,000. Okay, I'm writing much higher figure. That include all the branches, pre, para, in remote colleges, every college where nobody want to go. Okay, that means even for that 80,000, that means around out of 2.5 lakh 80,000, that means more than 1 point, that means 1.7 lakh student will be rejected. The PG entrance is more of a rejecting exam, figure is in front of you. And the premier branches, which I told you have to be among the 10,000. That means you have to beat 2.4 lakh students to get a seat of your choice. That's the biggest disadvantage of NEET PG exam. Now, look into this. Look into this. We had 5 seats. This amount, a good amount of seats were reserved. Only 1 seat is there. In NEET, in PLAB and MRCP both, you have passed the exam. Seats are open. In Indian NEET PG exam, you have to beat others to get a seat. But in PLAB, MRCP, you have to fight with yourself, you work hard, and you can pass the exam. No competition. No competition. Because definitely, there's no point in saying in India, different level of colleges are there. There are people, there are 22 aims are there. Can a private institute in a remote area can beat student of aims? No way. You cannot compare a motorcycle with a cycle, but it is there in Indian system, but this not in UK. Everybody has a bike, you clear the exam and you get a degree. No tension. Okay. Now, advantage of doing PLAB. So as I told you can work in UK without repeating MBBS. Somebody asked me, I added this line today only, do we have to do MBBS again? No. If you have done your MBBS in a recognized college anywhere in the world, you can directly write PLAB and you are allowed to do job in the UK. High quality training and work environment, there's no doubt about it. The quality of training they give you, not we have. Better work balance and much better salary. Direct exposure to NH, National Health Services system you will learn. Once you are in the system for you, then going for a MRCP is very, very easy, and you can stick after your PLAB, we will prepare you for MRCP, MRCS, FRCR, specialty and super specialty exam. You can do it very easily because you are already in the system. Global recognition, this again a very important point. And migration opportunities. You can go to any country like Ireland, Middle East, Australia, and UK also, or European country also. Now, a very frequently asked question. So this is since I get so many queries, so I'll like to discuss much more in detail. The question, I am an Indian and I am pursuing MBBS from abroad, any country other than India, Georgia, Russia, Armenia, or any other country, China, etc. And I have following to ask. Question number 1. I complete my MBBS in the country where you are studying and do internship in my own college outside India. Can I write PLAB MRCP without passing FMG? Brilliant question. Yes. Now, there's a catch. Suppose you are in country like Georgia, and one is you come to India, write FMG exam, and FMG, the failure rate is very high, that you know very well. And once you pass FMG, then you can do internship, then again you have to write NEET PG. But passing FMG and doing internship in India is mandatory to get NMC registration. Suppose you want that I have to settle in India, then you have to give FMG and NEET PG. But many of you, or maybe those people who are not Indians and they are coming from Gulf country or other countries who have nothing to do with FMG. Okay, then or those of you Indian people who don't want to come back to India, then you no need to write FMG exam. So you can appear for PLAB exam without doing FMG. FMG exam is mandated to get NMC registration number. So I hope you are clear about it. Okay. Now, can I do MRCP after passing PLAB? Yes. Just to remind you, MRCP is a world-recognized postgraduate degree of UK. It becomes much easier for you to pass MRCP after clearing PLAB because you are already in the system. Okay. Or MD medicine is not recognized in every part of the world. Suppose even if you've done MD medicine from Delhi AIMS, this is not recognized all over the world. Well, it is recognized in some part of the world, like Gulf country, they recognize Indian degree. Now, one more thing. Suppose there's a big hospital in any Gulf country, and they want 20 MD medicine or medical specialist to be more precise. They get 100 application. Out of 110, suppose 15 are with MRCP and 85 are MD medicine. And I'm the administrator. I'll first choose these 15. Come. Selected without any interview. Out of 85, I have to take only 5. So I'll take out of this 85. That means, again, if you are having MRCP degree, that means your selection is already done. One more thing, I have taken 15 MRCP and 5 I have done with MD medicine, maybe from Delhi AIM. If I am giving a salary of, say, just arbitrarily 100 rupees to this gentleman with MRCP, to MD medicine, I'll give only not more than 60. So even the salary is almost double for the MRCP. And with MRCP, you can go to any part of the world, not with MD medicine. I'm repeating second time. Much more valuable. I told you, much more valuable. You are getting much more salary. Even in the countries, they give much better promotion, early promotion to people with MRCP, not to MD medicine. So much more valuable. Very simple question. If I give you 100 rupees and if I give you $100, what you will take? Definitely you will take dollar. Much more valuable. Well, you can say it is 87 times more valuable than 100 rupee note. Pound is almost 100 times more valuable. So same thing as I told you, MRCP and PLAB are much more valuable. I think this one photo is self-explanatory. Now, how to prepare for PLAB? Well, PLAB 1. So we will train you. We will train you for PLAB 1. We'll give you online tests and discussion with excellent explanation. We'll give you around 3,400 questions with explanatory answer. And I can challenge and I can write in a stamp paper, they are the world's best tests and discussion. After every question, we will give you LMRP, last minute revision point. And if you remember those points, your question, 95% question will come from your LMRP only. And we will cover the entire syllabus. You don't need to read. We give one question, we give the explanation, the right answer. And we also give explanation of why other options are wrong. We will give you that also. So they are self-complete. So how you should read? Suppose you are doing tests of cardiology. You read cardiology from whichever book you have read in your MBBS days. Then you come and do our question. We will give you a test paper of 5. Beautiful question and beautiful answer. Okay, and then you find everything and you get 5 LMRP again, which you can remember. You can revise 2 minutes before the exam, within 2 minutes. So entire syllabus of MRCP you can revise in 4 to 5 hours before your final exam. So each question will have last minute revision point. Okay, LMRP. And before your exam, you will be able to revise the whole LMRPs in just one LMRP in just couple of minutes only you can revise. Entire paper you can revise in 2 minutes, one paper of 5 questions. Now, we will make a schedule for you. We will make a study plan for you. We will do hand holding. This is the most important thing. We will guide you how to study. Biggest problem of you all, even including me also, when I entered the medical college, we were all the topper of the schools. But once we enter the medical college, we all have difficulty in passing the exam. The level being, the reason being the level of school level was this, and the level of medical college is like looking into the ceiling. Nobody told us how to study, how to remember. Sir, I study a lot, I'm not able to remember. Okay, in the during exam, I'm totally flat. We don't have confidence. First, I'll tell you how to study. Study become the fun. Study the most boring thing in the world, no doubt about it. But me and my team will be doing the hand holding for you. We have a dedicated team headed by a COO who herself is a MD medicine, very brilliant doctor who is a very student friendly and will be taking care of you, everything. Even my support staff is amazing. They're all very caring people. We respond to your queries very fast. I think this is the best thing we can do. Nobody else will do this. So our teaching will help not only for the PLAB exam, but also for your university exam also. To see the multiple benefit. And once you have done your PLAB, you can continue with MRCP with us. Again, we'll train you. We will have dedicated helpline to solve your queries. Now, after PLAB life in UK, now you have passed, you are entered the UK. So you have to get GMC registration after passing PLAB 2. GMC registration is very easy. The way you pass MBBS in any country, you simply go to the online and fill the form and you get registration within a couple of minutes only. Now you join NHS as a foundation year, equivalent to equivalent post. And salary, how much salary? Initial salary, somewhere around, if I talk about Indian rupees, 38 to 39 lakhs per year. And you have to work for 48 hours only. If you work for 49th hour, you are being paid double. Indians, they work on Saturday, Sunday, they work on Christmas holiday, and they mint money. I think I don't need to talk more on this. After MRCP, you get salary, okay, you get somewhere around 55, 60 lakh. Again, you work, overwork, you get a huge amount of money. Consultant, you get more than 1 crore rupees. £1 is almost 100 rupees. Now, doing MRCP after PLAB. PLAB is a entry point to work as a general practitioner if you are just MBBS. But once in NHS, doctor can prepare for MRCP and we will guide you. We have full course for MRCP also. Well, few of you are interested for MLE, we have for MLE also. Everything we have. But at the moment, as I'm talking about mainly PLAB and MRCP, UK exam, so I'll talk more about that. But anybody want to go to USA, we have MLE also. Now, MRCP is a world-recognized postgraduate qualification. Okay. And I already told you, people with MRCP are always preferred everywhere in the world. MD medicine not recognized, the point I already discussed. And after MRCP, you can go for super specialty training. In fact, if you have done cardiology, neurology, most of the Indian corporate hospital like Medanta, Apollo, Fortis, they prefer MRCP. Okay, you are directly picked up from UK. What else do you want it? You don't have to apply. They will come and pick you up. It's just like somebody has done an MBA from IIM Ahmedabad. Companies come and they pick up the student well when they are studying MBA. MRCP is almost equal. So, to nutshell, to conclusion, PLAB offers a golden opportunity for Indian medical graduate to enter the NH with easier pathway, much easier pathway than NEET PG, better income and lifestyle, clear route to specialize via MRCP and MRCS, etc. Okay. And the condition that we see in Indian scenario, you know much more than what I know. How are the conditions? Not good, but much easier exam, UG level exam. Now, how to assess to our Dr. Bhatia Academy? Let me tell you, I was a founder of DBMCI, PG entrance high classes. I started in the name of DBMCI, Dr. Bhatia Medical Institute. It is there, but now we created a new division, DBA, Dr. Bhatia Academy. Okay, in this, we take care of the PLAB part, MRCP, USMLE, and NEET SS. Okay, so now, so how to go to our test series? We will give you lots of demo tests, how to reach to that. Download this app. Okay, Dr. Bhatia Academy, this I'm making him bigger. You can scan. I'm holding the screen for a couple of minutes, a couple of seconds. You scan it. Of course, I'll give you contact number later on also. If anybody want any difficulty, we are very much accessible. The best part, कोई सुनने वाला है. Not that we have just left you alone. I hope I have given sufficient time to scan you or click. This is for USMLE, MRCP, NEET, SS, and PLAB. Now, how to reach to our test series? So fill your detail in the app, DBA app. Go to PLAB test series and you see the demo tests and see the tests and explanation. Free tests are there. Well, for any query, please contact the number. Again, you can click the photograph. Number are there, email is there. Anything, any query you have asked, of course, I'll be answering a lot of your queries right now also.